Hello, everyone, and welcome to the Women's Fund's second conversation in a series of 3 we're hosting this summer on economic security. I'm so glad you were able to join us today. For those of you I don't already know, my name is Kim Theodore Seide, and I'm the program manager for the Women's Fund here at the Austin Community Foundation. And as a program of the foundation, the Women's Fund is a collective giving network dedicated to improving the lives of Central Texas women and their families. And we're a key strategy at the foundation to close the opportunity gap because the data in this field tells us something that I think many of us on today's call already know to be true. And that's that gender matters. Investing in a woman has a proven ripple effect, benefiting not just her family, but her greater community. So when we're investing in women, we're investing in our entire region. And we do this at the Women's Fund by dedicating philanthropic capital to breaking down the barriers to economic security, specifically by supporting nonprofit agencies to increase access to quality childcare as a necessary work support, investing in education as a pathway out of poverty. And really the last two of our strategies are going to be the focus of today's conversation, which is providing access to safe and affordable housing and contraception, specifically long-acting reversible contraception, to maintain a woman's pathway to economic security. Now, due to the unprecedented health and economic crisis we're facing right now, we knew that COVID-19 for women already facing economic insecurity would be disproportionately impacted. And 4 months into the pandemic, sadly, we are finding this to actually be the case. According to the Institute for Women's Policy Research, 60% of job losses from the pandemic were held by women. Women are also overrepresented in many of the essential worker professions. And according to the World Economic Forum, women make up 70% of all health and social service jobs globally. And now with school and daycare closures, many women are simply lacking the childcare they need to support this work, which is creating an unsustainable situation for families across the globe. In the US, we've also seen state governments respond to the pandemic by reducing access to reproductive health services, which has clear and long-lasting repercussions for women and girls. And further, there is mounting data that indicates domestic abuse is increasing as virus restrictions have created environments where women may be sheltering in place with their abuser. These statistics are sobering and concerning, and we need to start talking about them, which is what leads us to today's conversation, supporting women's health and safety as we shelter in place. And I am delighted that Kim Storin is joining us to moderate today's panel. I've gotten to know Kim through her work on the Women's Fund, and I think she's sat on just about every committee that we offer here. So I can definitely attest to her tireless commitment and dedication to women's issues. And I think many of you on this call may be very familiar with Kim Storin's volunteer work, but you may not know that she actually continues this work in her professional life too, as Chief Market Officer for Rapid Deploy, which they provide technology solutions for 911 communications and first responders. In fact, actually, as a result of the increased calls during the pandemic, Rapid Deploy just partnered with the state of California to implement a text from 911 solution that actually allows domestic violence victims to communicate with dispatchers when they can't talk. So Kim, I am really looking forward to today's conversation. I think it goes without saying you're going to bring a lot of insights to this discussion, given your professional and volunteer work. And I am so glad you're leading today's discussion. Thank you for joining us.
Thank you for having me, guys. This has been like a huge part of my life, both from a volunteer perspective and, as Kim mentioned, now from a work perspective. And it's just a topic that I'm so passionate about. But before we get into that and we start talking about all the impacts that we're seeing from COVID-19, I wanted to just start with a few quick housekeeping items before we get started. So, one benefit of being 4 months into this pandemic is that we're all really familiar with video conferencing. And as we're reminded here by our friends at Saturday Night Live, there's a lot of issues that arise, and there's always technical difficulties, but we're going to do our best to really make sure that we don't have any technical difficulties today. So what we're going to be doing is making sure everyone is muted, and then you continue to submit your questions. Speaking of technical difficulties, I'll just offer to everyone, I was kicked out of my office today by a tree trimmer. So I will handle this in 1 second, but just submit your questions at the bottom of the screen, and then we'll be sure to make sure that we answer those questions as we go through our Q&A. And so really that's it for housekeeping. I look forward to your participation in the Q&A, and I'm really delighted that today we're going to be talking to some community leaders from healthcare, housing, and the philanthropic sectors who are all working to ensure women are safe and healthy during this pandemic. And really beyond this pandemic. These professionals know that women cannot achieve economic security without having a safe home and access to the health care that they need. So I want to start and just introduce you guys to today's panel, and they're going to be talking about their work and how this impacts our investment approach here at the Women's Fund. So let me start by introducing Tanya Capson. She joins us from Waco, where she is the Regional Health Center Manager for Planned Parenthood, which provides age-appropriate, medically accurate sexual health education to more thousands of teens and parents across the region. At Planned Parenthood, she and her team work to create healthier communities by providing comprehensive reproductive and related healthcare services. So thank you for being here today, Tanya.
Thank you so much. I would like to thank, the Austin Community Foundation and the membership of Women's Funds for their continued support of Planned Parenthood. We couldn't do it without your help. It's an honor to share in this discussion as we talk about, some of the things that have become our reality, dealing with this pandemic. So I appreciate the opportunity to come here and visit with you all.
Wonderful. Second, I'd like to introduce Erin Goodison, who's the Senior Director of Housing at the SAFE Alliance in Austin, Texas. Erin has 23 years of nonprofit experience, including 18 years at SAFE. Her work is primarily focused on the intersection of homelessness and abuse. At SAFE, she has helped to develop peer support programming, as well as policies, practices, and staff training on housing. WAWA housing protections, voluntary services, empowerment advocacy, trauma-informed services, and LGBTQ-focused services. Whew, that's a mouthful. I'm delighted that you're going to be sharing your expertise with us here today, Erin.
Thank you. Thank you for the invite, and thank you for the support.
Excellent. And then last but not least, Lourdes Rodriguez joins us from St. David's Foundation, where she recently joined in March, which, what a crazy time to start a new job, as their Senior Program Officer for Women's Health. Her most recent position prior to joining the foundation was Associate Professor and Director of Community-Driven Initiatives at UT's Dell Medical School. As a public health practitioner, and in both academic and philanthropic roles, she collaborates, develops, and evaluates initiatives to improve health with people most impacted by health inequalities. Welcome, Lourdes, and thank you for joining us.
Gracias por la invitación. It's a real pleasure to be here today. Thank you.
Wonderful. So with those introductions out of the way, let's get started on our exciting facilitated discussion. And again, just a quick reminder, continue to put your Q&A into the chat in the Q&A section, and we'll continue to monitor that as we go. So I'd love to start broadly, and I'm going to ask everyone here on the panel to share how this pandemic has impacted the services that your organizations provide. And how do you think this work has changed since we began social distancing? Tanya, why don't we start this one with you?
Sure. So, the pandemic brought focus to us for the immediate need to have some other avenues for patients to come in and see us. We needed to be able to deliver healthcare via telehealth or remotely because of the need to social distance and because people were sheltering in place. They still needed to get care, and so we really had to make our presence more digital, provide technology and things like that, so that patients, could continue to come in or come to us for the care that they need. We were impacted pretty greatly. Our in-person numbers were reduced across our affiliate and throughout all of our different health centers. And the revenue that we anticipated, that we had budgeted for, was, decreased by upwards of $500,000 because of the lack of patients coming into the health center. And so even though we were already talking about doing more digital visits and things like that, we had to really ramp things up really quickly and put in processes and apply for grants for equipment and technology that we needed to make that happen, really, really quickly. So it's definitely affected us, and we are just kind of dealing with whatever comes our way the best way that we can right now.
Lourdes, on your side, have you seen similar issues in terms of ramping up from a digital perspective? What else have you seen kind of your work changing from a
Yeah, so one of the things that we had to change immediately was the way that we receive, process, and expedite the request for support process. Our processes are usually, we spend a lot of time doing relationship building with our potential grant partners, invitations are issued, projects are developed in collaboration, and that process from initial conversation to when the check is issued is a 6-month process that we've had to cram into a much shorter time span of 2 months for each one of our 2 cycles of review of funding. We've added a review on to ensure equity in our process. So we were forced into it in a way that was both exciting and terrifying.
Wow. How about with you, Erin? What are you seeing?
Well, yes, this pandemic just seems to have cast everything into higher relief and really illuminated what already existed in terms of disparities and inequities. So the work that I do with SAFE is around helping survivors of domestic violence, sexual assault, and human trafficking to secure safe and stable housing, and then build up the support networks and the skills that they need to maintain that on their own. Doing this work for a long period of time has taught me that surviving violence and abuse is its own full-time job and a very, very hard one. Surviving homelessness and poverty are additional full-time jobs on top of that, and the amount of time and barriers that folks were facing just to try and secure enough food, education for their children, seek employment, all of those things were already overwhelming. Mm-hmm. And all of the adaptive measures that many of us have taken to get through this COVID-19 pandemic are unavailable to people that were already going at over 100% every day and did not have access to technology like Wi-Fi at home, who do not have computers at home, who may be lucky to have a cell phone. Most of our services used to be in the field. We'd go meet people where they are with home visits, drive them to doctor's appointments, accompany them to court. Not being able to do that, our first investment was in trying to provide every household with a cell phone and cell service each month, which is not something any of our grants fund. So just trying to find that flexible support, like through the Women's Fund, to meet that need. And it has been helpful in a learning experience, but it also just points us forward that unless we help bridge this technology and access gap, and unless we recognize how it does fall disproportionately, people of color, women of color, and abuse survivors in our community, we're really, really not going to be able to move forward, both with promoting safety and stability for those we serve and promoting equity in our community.
So one of the things that I've heard from the commissioner of the FCC recently is that millions of people are relying on what they are calling parking lot Wi-Fi, which is basically the free signal. And this pandemic is really demonstrating that we need to address getting broadband and better Wi-Fi technology, better mobile technology for all, regardless of whether we are in rural, urban, or suburban areas. So I'd love to hear a little bit more, Lourdes, on what you might be seeing in terms of that gap in technology and maybe some of the disparities that are arising due to that in your work. And where do you think philanthropy can play a role in dismantling some of those systemic inequalities?
So one of my colleagues, Abena Asante, her portfolio focuses on rural areas. And we've seen a huge disparity. We knew that before the pandemic hit, but now before it was framed as a luxury. Access to broadband Wi-Fi, it's a luxury, but it really isn't. It's about education. It's about access to healthcare for accessing resources that are now provided through telehealth. So we are keeping an eye to the ground for supporting the organizations that are doing the documentation of need. We started some of that work prior to the pandemic. And so that there is a push for the implementation of some federal rulings around increasing access to internet broadband services in rural areas, because the regulations exist. The will to implement those regulations does not. And so we're supporting the organizations that are documenting the need and making the case and standing fully behind them in terms of ensuring that they have the financial means to get the equipment that they need if they're pivoting to telehealth, for example. And then we're keeping an eye also for a statewide initiative to bridge the digital divide. And I'm going to share that with the folks at ACF so that they can send that more broadly. I don't want to derail the conversation, but I will send that information to Megan.
And it feels like, I mean, I think now more than ever, this is something where we as a community need to start pushing, because I think, and I see the same thing in 911, right? Where it's amazing to me that text to 911 is not a reality in most areas. And the issues with domestic abuse that have cropped up in this pandemic, having the ability to actually communicate with public safety when you can't communicate on your own without being in danger is a real issue. And I think the more that we can be, frustrated and upset and demand change, not just from a public safety standpoint, but also from a broadband access standpoint, we have to demand better and work to make those changes, because it's the foundation that will really drive the change in the way that the broader community can access. And what I think, and I'm curious because this kind of segues into the next question here, what I think might be a longer term change that we're seeing. So I'd love to kind of pivot and talk to you guys a little bit about, do you think we are in the new norm? I know we're so sick of that that comment, right? I'm wondering, like, do you think that the world of virtual services will continue, even post-pandemic? So I'd love to Erin, kind of start with you and get your thoughts, and Tanya, get you to weigh in as well.
I think there's a great opportunity there. I mean, at SAFE, our crisis line, Safe Line, has seen our calls increase throughout this pandemic. Calls, texts, and chats coming in increase. Folks are experiencing increased violence and abuse and really trying to connect. But on the housing side, I hear from homeless service providers across the community that they have housing opportunities available and they're having a hard time reaching the people that have been referred to the program because the pandemic has actually worsened access to Wi-Fi, internet, calls, and bridging that digital divide and putting a cell phone, a smartphone, a laptop, free Wi-Fi in the hands of every struggling household in our community has the opportunity to transform what their experience of accessing support looks like. How much more empowering and how much greater dignity would you have being able to access telehealth appointments remotely instead of having to ride the bus 4 hours round trip with small children in tow to try and have a 15-minute mental health session with your provider, and then another hour, around to the pharmacy to try and pick up your medication. And when I think about some of the families we serve, we've got families of 5 trying to share one cell phone for the entire household. And that's, mom trying to access support services remotely by phone, access any benefits like Medicaid or SNAP by phone, to share with the teenagers who need to do their schoolwork through this one cell phone, and then also small children. It's just not reasonable. And I don't think any of us could imagine what that would be like. So I prefer to focus on the hopefulness of, if we put these things in place, if we take these steps, we actually might create a more equitable environment for everyone that needs a little extra help in our community.
Tanya, what are you seeing on your side?
Yeah, so, I completely agree with Erin. We believe that the landscape of healthcare delivery is going to be forever changed. I mean, now that people know that telehealth is an option, I think more and more people, even post-pandemic, are going to continue to want to have the flexibility of telehealth visits. And so, I think it's really important, like Erin said, that we find a way to provide, patients, people with the tools that they need to be able to access care in a way that's equitable, to the rest of the community, because I think this is where healthcare is headed.
Yeah, I agree. I think we're definitely seeing across the board that, people's behavior will change as a result of all of this as well. So with that common theme of being access, right, and women simply not having access to safe, affordable, and consistent housing and healthcare, we know that there's a laundry list of reasons why this is that are complicated and complex. But could you guys share a little bit about some specific examples of the obstacles that women are facing? I think for the folks that are dialed in with us today from the Women's Fund, for us to understand where we should be focusing our time and investment, and really understanding kind of the narrative behind what's going on, and getting it, out of kind of the bigger picture and really getting into more specifics helps us understand how we can be impactful in our investment. So maybe on this one, Tanya, if you want to start on this one, and then we'll go around the horn as well.
Yeah, so, for us during the pandemic, with us being Planned Parenthood, the legislative barriers are huge for Planned Parenthood. Lawmakers making, decisions that impact, women's ability to get reproductive health care, a woman's, ability to plan and space out her pregnancies like she wants to, that's huge for, part of the work that we do. If you have those legislative barriers, it adds even more stress and strain to the already, just kind of crisis that we find ourselves in right now. So we definitely need to have support to reduce, those barriers, making sure that we have accessibility to our patients, making sure that, we are able to stay open and to see patients, because a lot of the times for our patients, they are underserved, they are underfunded, they don't have insurance. And so sometimes we're kind of the only place that they go to for care. They're not really worrying about their blood pressure and things like that. They're worrying about, their breast mass that they might have, or, things like that. And so just making sure that we stay open and stay available and are here as an option for those patients is super important for us.
Lourdes, how about on your side? I mean, from your perspective, what are some of the obstacles? I know you're in a little bit of a different realm because you're not necessarily providing those services, but what are the obstacles that the St. David's Foundation is seeing?
First, I just want to if I were wearing a hat, I would take my hat off to Tanya and Aaron and the work that Planned Parenthood and SAVE do, because this is a tough moment, and women are bearing the brunt of it. As we heard, they make about 63% of the frontline providers, even though they make about 40-something% of the entire workforce. So they're exposed. It's really disproportionate, the amount of women who have the capacity, the ability, the privilege to be able to work from home. And when they do work from home, the burden of childcare, even with the best of partners, usually falls on women. I'll speak for Latino families, in which we usually have 3-generation households living under the same roof, and the burden then becomes for many women of being caretakers for their parents, their aging parents, and their kids, right? We've been thinking a lot about how can we deploy our resources in a different way that understands those contexts, right? So we fund services and organizations, but when we've been thinking about our partners differently now as a channel of communication for constituencies that are experiencing most vulnerability, so that some of our grantees have come to us saying, we want to support our constituents with their basic needs, with rent, with utility support. And so our giving has changed. Our giving is not just programmatic, but it's also to support basic needs, not only for the amazing people that are doing the work of providing services in the social service sector, but also so that they can serve as pass-through for the constituents that they serve. I don't know if that answers your question.
Yeah, no, definitely. Aaron, on your side, what are the things that you're seeing as those specific obstacles that are really impacting the clients that you serve?
Well, I mean, I think it all plugs in to what has already been mentioned and some of the conversations we're beginning to have about the unpaid labor that women do in all of our families and communities, with caring for children and elders, household management, and just all the value that's there and not really recognized, compensated, or supported. The families that we serve were already struggling with childcare because real estate prices and rental costs are so high in Austin and going up every year. In the years that I've been at SAFE, we have watched all of the childcare centers in our neighborhood disappear because they can't afford to stay open. So even if a mom is fortunate to secure funding for childcare, she couldn't work a full-time job because she might have to ride the bus a few hours, drop a child at an available childcare all the way across the city, and then to work. So at most, she might be able to work 4 hours in a day, but spending more than 8 hours on commute and transportation and childcare drop-off. Unfortunately, I think even that might not be available by the time we go through this, because I'm not sure how many childcare centers will be able to afford to stay open. So we really have to re-envision, what does childcare look like? What is the value, and are we willing to invest in it as a community? And what might that look like? For abuse survivors, most express and demonstrate a willingness to continue to put themselves in danger if that's what they believe is best for their children. So I also have concerns, as violence is escalating, that fewer folks will leave if they know that they can't find safe and affordable housing, if there is no access to childcare, if they know they won't be able to maintain employment and keep a roof over their kids' heads and shoes on their feet, with schools being closed. So there's a real risk of increased violence and lethality for a lot of vulnerable women in our community if the support services don't exist that can help them have a different path out of that violence. And then just, what are career opportunities going to look like? Like, if there isn't childcare, what sorts of opportunities for essential workers when that work continues to be paid at a lower rate than its value? Is that even sustainable? And what will accessing systems look like when the Social Security office is closed and the DPS office is closed and the Vital Records office is closed and you can't even get vital documents? How are you going to enroll or transfer your children's schools or apply for permanent housing? Just barriers upon barriers upon barriers. And I'm really wondering what this path forward is going to look like. But ample opportunities for help in almost any direction. Good that we can all do.
Absolutely. So, I mean, you've just listed, I mean, all of you guys have just really painted a picture of what the challenges and obstacles look like for women, and particularly women of color, in our local area. And it's daunting, right? As an investor in the Women's Fund, you hear all of these things and you're thinking, like, what can I do about this? And so I'd be really curious, and we just got a question in the Q&A as well, so I know this is top of mind, but how can we, as, you know, Women's Funds investors and philanthropy overall, how do we have to change and how do we have to evolve in order to better deal with these obstacles that are cropping up? I mean, I think the Women's Fund did an amazing job this year of pivoting quickly to be able to say, we need to change how our grant making process is working from a process perspective, how we're actually funding and what we're funding, and how do we actually make this money available to people quickly because of the pandemic. But I'm curious of, you know, when you look at that list of obstacles, it is just overwhelming. And how can we evolve, in your perspective, to help address those? Tanya, maybe if you want to start with this one, and then I'd love to get Lourdes your thoughts as well.
Yeah, so you know, having the access to the funds and the different grants that we have available definitely gives us some flexibility to address the needs of our communities and our patients. It allows us to expand our telehealth services and provide those services in a way that's accessible to our patients. So, you know, it helps us to provide education, options and things like that they need to have.
Excellent.
I think that, you know, necessity is the mother of invention. And I would say that crisis is the mother of pushing very slow processes to make them a little bit easier. And the reason why I say that is that there's been a lot of policy change and process change where people have had to streamline the way that they do things. And I think that some of that, the meeting of the will and the way, so to speak, right, is something that we can take with us when we are on the other side of this pandemic. So new ways of figuring out, if we streamline, for example, applications for SNAP, because we were in a pandemic, and the way that people went through that process, why can't we keep a streamlined process? Why do we need to get people jumping through hoops, right? If we were able to find temporary housing for people experiencing homelessness in hotels, then maybe we've got something there in terms of a solution for our housing problems, right? So this is the moment to experiment with quick strategies for solving huge complex problems, because we don't have the time to wait for like all of the evidence that you know something works. Experiment and then keep the things that are working. I think that there's also a lot of room to learn from mutual aid groups, and figuring out how can philanthropy stand fully behind the support of individuals, even when they're not affiliated with the nonprofit infrastructure. So I'm reminded of, for example, the cooking circles that community organizers from Go Austin, Vamos Austin have organized, where like it's like making stone soup. Like people just bring, if you don't know the story, Google it. It's a beautiful story of like collective coming together to make something out of very, you know, little things. So those groups are self-organizing. The people that have a little come together and they cook for other families. In the same way for the organizations that are supporting mamas that are, you know, babies don't wait in a time of pandemic, they keep coming. And mamas are losing their network of social support in this moment because we're being asked to socially distance, to physically distance, to remain socially connected but physically distant. So so they're mobilizing in ways that support new moms with, you know, with meal trains and with people, you know, sharing resources when possible. And those grassroots, those organic groups of mutual aid, they can be sustained. We just need to figure out how do we change our mechanisms in philanthropy, our giving, to be able to serve as the, you know, fairy godmothers that support that kind of work moving forward.
So, I mean, my big takeaway there is, you know, from a Women's Fund perspective, we really have to keep thinking about how we experiment. So really, really good thoughts there. And I think, you know, that that ability to be, so in transformation in general and in crisis, I always think that the attributes that women and organizations need to adopt is curiosity of what's next, agility on how to do better of how we used to do it, and let's be agile on how we do it better, and then have an ability to take some calculated risks. How have your organizations kind of adopted that mentality of curiosity, agility, and risk taking? Erin, has SAFE as an organization kind of thought differently about how they provide those services as well right now?
Peer support, which is really honoring and centering the role of people with lived experience. So that's one of the cornerstones of our services at SAFE. Our peer support model is around survivors of abuse and exploitation who either as staff or volunteers work peer-to-peer, survivor to survivor, providing support and encouragement and advocacy to those we serve. And that has been really vital in raising and lifting voices and providing feedback that folks might hesitate to otherwise provide in a system out of fear that, well, will I still get services? Will I still get support if I ask people to do things differently or advocate for a change? I think that any place where we see at SAFE or in partner organizations that leadership of those with lived experience being centered, that's where really dynamic innovative, exciting things happen. So any opportunity to listen to those most affected and ask, what do you need? What would be most helpful? What would that look like? To me, that has done the most good for our services. And then staying open to, we're going to have to continue to listen, learn, and evolve every day as we show up for work, because as situations on the ground change, needs may change. But it's just wonderful to hear so many echoes of that as well. How do we center those who are most impacted and let them lead us?
Yeah, absolutely. Has Planned Parenthood, Tanya, also taken kind of an agile and curious approach to how to recenter the offerings that they have for their clients?
Yeah, so we made a lot of expansions to our telehealth services. Prior to the pandemic, we were providing like birth control, via telehealth, maybe UTI treatment, but we've expanded our services to where we're now providing transgender hormone therapy via telehealth, patients that are established patients who might be having, some infection type symptoms can actually do a telehealth visit and explain those things, virtually over the phone and in the privacy, of a room with a clinician and kind of get advice that way and treatment that way instead of having to make the trip here. And so we did expand our medical standards and guidelines in order to be able to help more people in a way that we weren't able to before. And I think we'll continue to do that because we're seeing that it works and people enjoy the flexibility of having those options. And so I think, we're just learning every day and we're continuing to find out what we're capable of. And with more technology options and things like that, I think it'll give us even more, it'll give us the ability to reach even more people. So
that's great. So before we get into the Q&A section, I'd love to end this part of the dialogue with kind of a round robin, rapid fire, thought around if you guys had unlimited time, money, talent, energy to devote to these causes that we've spoken about today, and if you woke up the next morning with these superpowers, what's the first thing on your list? Talk about prioritization. The first thing on your list that you're going to go focus on. Why don't we start, Lourdes, with you on this one, and then Erin, then Tanya.
I would make room for people of color to be in position of leadership and power and have them lead the work that they have not been able to because of all of the efforts that we've put into closing doors of leadership and opportunity and power for people of color.
That's great.
It is very hard to follow that, but apologies, because it seems so simple. But I would put a laptop, a smartphone, and free Wi-Fi in the household of everyone in our community who doesn't have it.
Tanya? Did we lose you, Tanya? Oh, I think we might have lost her, so I'm sure she'll jump right back in and have something great to say. But I just wanted to start and just say thank you to all of our panelists for providing insights on the vast amount of challenges and obstacles that women are facing right now. I think we are as overused as it is, we are in an unprecedented time, and we've only really started to tap the surface of what's going on and what we need to do better. But I do want to make sure that we have some time here to open this up to any questions from the audience. So I'm going to encourage everyone, if you have a second, go ahead and type your questions into the Q&A, and then we'll be able to ask those questions as we go here. So we do have one question that's come in, and we'll start with this one. So the question is that we focused so much on the challenges related to the pandemic, and there are many of them, we know that. But have you seen any positive changes in your work since we began sheltering in place? I'm curious of whether you've seen your organizations respond in creative ways that might continue after this pandemic. I think we've talked a little bit about that one already. But so I think really the question is like, what are the positive changes that you've seen? And then after this question, we'll circle back for Tanya's final thought. The last question.
I will say I'm very excited about the range of services that we've been able to offer remotely, and bringing support groups through counseling and peer support online, offering different life skills classes and workshops remotely, making sure that our staff and our clients have cell phones so they can communicate by text, call, email, whichever way they want. And I've really, really seen those that do have technology access be thrilled with telehealth appointments, both for physical and mental health needs. So I'm hopeful that all of those things will be able to continue.
And I will say that there's, we as witnesses of the power of the adaptability of our grant partners, we have seen how folks who can move their programming digitally have been able to do so in amazing ways. There is something to be said about how now there's also an opportunity to be more civically engaged. So I've also seen how people are more likely to attend a city council meeting because you can do so via Zoom and participate and give testimony. So I am very hopeful about that, that moment of civic engagement, because people who were never in position of vulnerability and are now in position of vulnerability and had experienced a life of comfort because of their privilege, and now they don't have it, they have become the best allies of people that for generations have experienced vulnerability. So to me, that's hope.
Tanya, what are the positives that you see?
So I feel like, we have really learned a lot about what we're capable of doing here at Planned Parenthood, how quickly we can make changes, how quickly we can get things moving in a direction that is going to impact our patients in a positive way. Before, like you were saying, Lourdes, it would take a long time to go through process changes and, getting all the approvals and making sure that everybody has a say. So, I mean, we really realized that we could make big changes in a short amount of time with, that are going to be super impactful for our patients. And so I think we will continue to learn from what we've had to kind of deal with in the past few months, and we'll take all of those things going forward and hopefully continue that trend of moving forward and making sure that we make changes that are always going to be positive, that are always going to positively impact our communities and our patients and the women that we serve.
So Tanya, just because we lost you on the last final round robin, we'd love to know what would be your number one priority that you would solve right off of your to-do list, if time, money, talent, energy was not an issue.
I would make reproductive access to reproductive health care free for all. Anybody and everybody should be able to come in and get whatever type of care that they want without getting, without having to be judged by anybody, without having to worry about how much something costs. Women should be able to choose whatever birth control method they want, whether they want to use birth control, whether they want to continue a pregnancy. Like if I lived in the ideal world, then, it would be a question. Like, people could just go out and make the choices they want to have and have the capacity to just do what they want to do without having to worry about money and who's going to pay for it and how am I going to get this.
Yeah, that makes sense. That's great. Thank you. So what are the three organizations that you represent doing to seek and train people of color in leadership roles? So I think, Lourdes, you're excited. We're sending this one over to you first.
So I'm going to say, Robbie Osley, thank you. God bless you for asking that question, and keep asking that question of in every space that you walk in, what are you doing to create pathways for people of color to be in leadership roles? So, so in the past, prior to the pandemic, we've supported folks to take and participate in the Leadership Austin program. That's one way to get networked to the people that run this place. And right now we are cooking up a fellowship And we are going to be testing the fellowship in 2021. It's a fellowship that we are starting with Latinos and Latinas, but we hope to expand to other people of color, but we wanted to start somewhere small. And the idea is to not only provide an opportunity to learn about philanthropy, right? So that we can start creating pathways for more Latinos to come into philanthropy. About 2% of leaders in philanthropy are Latinos, compared to 9% African American, and then everybody 10% the other, and then everybody else is white. So, so this fellowship we are envisioning as an opportunity to work with other foundations to create a spot for a fellowship where folks will be working in learning about the ins and outs of philanthropy, but also that they will have a capstone project of sorts where they would design new ways of doing things based on the perspective that they bring. So it wouldn't be about indoctrinating people into leadership roles in philanthropy, but creating pathways and also learning from their perspectives. So thank you for asking that question, and keep asking.
That's great. Erin, what about on the side of SAFE? What are you guys doing to think about this?
Well, Lourdes said it better than I ever could. I think, recognizing that there is really established and capable leadership amongst communities of color all throughout Austin, Travis County, anywhere you go in the world. And so I think some of the conversations we're trying to have are, what would be a barrier to a leader of color coming to or staying in our organization, and how do we center the leadership of people of color, and how do we invest in it in a way that the organization can grow towards equity, and learn from the already existing work in leadership that has gone before.
Yeah. Tanya, how about in Planned Parenthood? Is this something that's top of mind for your organization as well?
We definitely want to make sure that we are very inclusive of all people of color. We participate annually in Solidarity, which is a Planned Parenthood Federation of America. And I myself have gone to that conference, and we send people every year to that conference, and it just really helps to develop leadership skills. You meet other people of color who are in leadership roles. It gives you the opportunity to just listen and learn and have a voice in a safe place. And we're able to take a lot of those things that we learn from, meetings and conventions like that we're able to go to. So we participate in that, and then we encourage our staff of color to make suggestions and to provide us with information so that we can make sure that everybody's voice is included.
Mm-hmm. That makes sense. So we have another question that just came in from Shelby, who's asking, why can't we think big and convene foundations and private investment to issue PRIs, MRIs to keep a consortium childcare centers open across the city? Anyone want to jump in on this one?
Let's do it. Let's do it. I think that right now there's one of the biggest problems is that because the majority of the infrastructure of childcare is for profit. It's a business. Mm-hmm. There is no existing mechanism for philanthropy to support it. So a PRI is a great program-related investment is a great way of thinking about it. Currently there are conversations about learning and childcare pods, ruminating across the city, and I am keeping an ear on the ground to see if that's an opportunity for investing. But Shelby, your call. Let's talk about it.
The gauntlet has been thrown. I think we all need to step up to that challenge. Great questions. So we've got just a few more minutes here. So let me just make sure that everyone remembers if they want to ask their question, go ahead and throw it in the Q&A section. And then I know we did hear, Tanya and Planned Parenthood talked a little bit about how they're using the grant from the Women's Fund. But I'd be curious, Erin, if you could talk a little bit about the work that SAFE is doing with the investment that we've made and the progress that you're making on that front.
So the Women's Fund Investment in SAVE is to support our domestic violence rapid rehousing program. It's a new program. We're not even a year old. And HUD is our primary funder of that through their continuum of care and homeless services. The Women's Fund support helps us meet our match requirement. HUD has a 25% match requirement. So in order to bring that money into our community and serve survivors, we do need community support to help with that. And it also can offer a bit more flexibility, which is something we're very grateful for, helping with some of those costs, like keeping cell phones and service in the hands of those we serve so they can call 911 if they need help. They can reach out to service providers and support, and they can help their kids get access to their educational materials. We're incredibly grateful and hopeful that by providing safe and stable housing to vulnerable families, that'll be the first step. We want to figure out how to connect them with safe childcare, education, and employment opportunities that are meaningful and really recognize what they have to offer, and then just see all the good that they will do our community with their contributions moving forward.
Excellent. Thank you for highlighting that. So we're in the very end of our session here, and I just can't thank you guys enough. I know I've learned a ton. And I wrote down 3 things that I'm walking away from this with. Number 1, our philanthropic organizations need to look more like the communities they serve, and we have to figure out how to make that happen. Number 2, we have to solve the tech divide. That's a non-negotiable. We've got to figure that out. And number 3, we all need to experiment. And that was such a great quote from Lourdes on how we start to think differently and really, experiment in the way that we're thinking about things and how we're executing and how we're funding. So I think, those are the 3 things that I really walk away from this with. Is there any last thoughts that you guys want to share with the group? Any other takeaways, Erin, Lourdes, or Tanya, that you might have had from this conversation that you hadn't thought about before? I'm sure you live in this world, so it's probably all a part of your daily thinking. But any final thoughts before we wrap up?
I just want to express my gratitude for being allowed to be in the same virtual space with Erin and Tanya. So thank you so much for the invitation.
And I would just like to again thank, Women's Fund and Austin Community Foundation for their continued support. We couldn't do this without your help. The work that we do in the community here in Austin, it is just tremendous, the amount of support that we're able to provide to our patients with the access to those grants. So we just appreciate that so much.
Yeah, it was an honor to even be included in this group and to learn from all of you, but also the battery recharge, just in getting to have the visioning and inspiration conversations. Thank you. Thank you. It's needed.
Well, so I also want to encourage everyone that has joined today to share some of your learnings on social media, share what you've walked away from this conversation with. And, the social media works right now, especially because we're not seeing people face to face. So speaking of social media, I have a fun little surprise. After I posted on LinkedIn recently that I would be hosting this conversation with the 3 of you amazing women, Fogo de Chao reached out to me on LinkedIn and wanted to share their thank you for the work that you guys are doing. So Fogo de Chao is giving each of the 3 of you a $75 gift certificate to use for a socially distant dinner, or you can take out as well. And so we're going to be contacting you guys after this because they have amazing gratitude for the work that you're doing. And the work that you're doing right now is so essential, and it's so hard, and it's so challenging. So thank you from both me and the Women's Fund, but also thank you from our new friends from social media, Fogo de Chao. I hope you guys enjoy some delicious steak on them.
Did you say date night?
That's awesome. Thank you.
Yes, thank
So
you.
wonderful. And on that note, kind of a fun way to end, Kim, I'm going to turn it over to you to share more about how folks can get involved in the Women's Fund.
Yeah, sure. I'd be happy to share more information. And I just want to say a huge thank you to all of our panelists. My batteries have been recharged. Kim, thank you for leading a wonderful discussion and for sharing your thoughts and insights with all of us today. For those of you who'd like to learn more about the Women's Fund and want to get involved, we'd love to continue this conversation. I always so enjoy meeting folks who share our passion and commitment for women's issues, and we'd love to hear from you. If you'd like to learn more, that's my phone number and work email on this slide, so please be in touch. I'd love to share more about the fund with you. Also along those lines, if you'd like to learn more, I hope you'll join us for our next Lunch and Learn discussion, which is scheduled for Friday, August 14th. The next time we're meeting, we're going to be discussing the impact school closures have had on women. So we'll be taking a look at the emerging data on the pandemic's impact on female workforce participation. And we're also really excited that Dr. C. Nicole Mason, who's the president and CEO of the Institute for Women's Policy Research out in DC, is actually going to be joining for that to discuss their most recent report and also the caregiving crisis that our country is facing right now. So again, I just want to say a huge thank you to our panelists and Kim for today's discussion. We hope to see you again on August 14th. And until then, have a safe and sane rest of your summer. Stay healthy and be well. Take care. Bye.